Hi, and welcome to Ocuverse AI, where we explain complex eye conditions in a way that's clear, supportive, and empowering. Today, we're talking about proliferative diabetic retinopathy, or PDR, a serious complication of diabetes that can lead to vision loss if left untreated. Even if patients have excellent blood sugar control, this condition can still cause damage. But the good news is, with consistent treatment, vision can often be preserved and the disease controlled. What is proliferative diabetic retinopathy? Diabetic retinopathy happens when diabetes damages the blood vessels in the back of the eye, in a layer called the retina. In proliferative diabetic retinopathy, the damage has advanced. The retina starts to grow abnormal new blood vessels in an attempt to get more oxygen. Unfortunately, these new blood vessels are weak. They can bleed, form scar tissue, and even pull on the retina, causing serious problems like vitreous hemorrhages or retinal detachment. This stage does not always come with swelling in the central vision, which is called macular edema. So patients' vision may still seem okay, even though the disease is progressing. The first step in treating PDR is usually a medication called Avastin, injected into the eye. However, treatments may vary depending on the individual patient and eye. These injections are crucial to help shrink the abnormal blood vessels, reduce the risk of bleeding, and stabilize the condition early. Patients typically start with a series of 3 injections, one every 4 weeks. The eye is numbed beforehand, so most people feel little or no discomfort. Patients may experience mild irritation for a day or two afterward, but serious complications are rare. Please see the video on Ocuverse AI on intravitreal injection for more details. Once the abnormal blood vessels have started to shrink with injections, laser treatment called pan-retinal photocoagulation, or PRP, is typically performed. This laser provides a more permanent solution to the treatment of proliferative diabetic retinopathy than injections alone. Injections work well, but their effects are temporary and only last a period of months. PRP is performed in the office and uses a laser to treat the peripheral areas of the retina that aren't getting enough oxygen. By treating these areas, the retina produces fewer signals to grow harmful blood vessels. This typically requires 2 to 3 sessions per eye, spaced over several weeks or months. During PRP, patients may feel mild discomfort, an achy sensation, and a headache. The discomfort typically resolves within a day. The vision is often black after the procedure and slowly returns over a period of several minutes. It's important to know that PDR is not cured with a single injection or laser. Most patients require treatment over 3 to 5 years, with repeat injections, additional laser sessions, and sometimes surgery. Even if the patient's blood sugar is perfectly controlled from now on, the damage to the retina has already happened. Without treatment, the disease will persist, worsen, and may lead to permanent vision loss. Even after initial treatment, many patients experience recurrences, such as new bleeding in the eye, new abnormal blood vessels, or pulling on the retina from scar tissue. When this happens, patients may need to restart injections, laser, or undergo a surgery called a vitrectomy, where the blood and/or scar tissue from the eye is removed to stabilize the retina. These interventions are highly effective, but require commitment and follow-up. Here's the good news. With consistent treatment, PDR usually goes away over time. Staying on top of appointments and following the treatment plan gives patients the best chance at preserving their vision. Stay committed, ask questions, and remember, patients are not alone in this journey. At Ocuverse AI, we believe knowledge is power. Vision is our focus.